Well, good Monday morning to you. Welcome to our live edition of the Doctor's Nutrition Show. I'm your host, Jim Tabor, and this is the live show that we do every Monday morning. We have you call in and ask questions regarding our topic of the day. Of course, this is Doctor's Nutrition, so Dr. Jim and Janine Fox from Doctor's Nutrition, Cowan Road in Gulfport, just south of Pass Road, are here every Monday to talk about some great things to help you live a healthier lifestyle. Good morning. On the show, we're talking about genetic predisposition. You've heard about genetics, but I've never heard about genetic predisposition, and I had to do some study on it and research and everything. So I'll let you explain to our audience what is genetic predisposition.
Well, when you think about genetics, genetics is our genetic code. Okay, now that's our genotype. Now our phenotype is how we express those genes. And so that genetic predisposition that he was talking about is your genotype. It's the genes, what they can do if things work right, and things that cannot do work if they don't work right. And so that is the predisposition. You can have, for instance, a predisposition in your family, say for instance a family history with strong cardiovascular problems like heart disease, strokes, things like that. That means you have a strong predisposition for that. Doesn't mean you're going to have it. Has a strong predisposition for it.
Right, and even diabetes, type 2, is also runs in families, and you have a strong predisposition, but if you do the right things early, and you change what you eat, and you change what you do, which is your epigenetics,
right,
then you can actually prevent from having the problem. And that's what we were talking about, is things you can do to prevent from having the problems that might be in your genetic code, but you can change them. So it's not inevitable. So there are things you can do. But if you just say, oh, I'm going to have this anyway and do what you want and eat what you want and do everything, then guess what? You are going to have it.
My dad had heart disease and my mom had diabetes and all this, so I'm predisposed to, I'm probably going to get it too.
Yeah.
But as you said, there's things you can do.
There's things you can do to change it.
Yeah.
And so you don't have to have it, but you want to do everything you can to try to prevent. Again, we talk about prevention a lot here. And it is, you know your genes, and you know your family history. Most do. I run into a lot of people that don't.
Yeah.
And when it comes to people that don't know their family history, it might be a good idea to do some of the genetic testing that are out there to tell you what you're predisposed to, so you know what you can do to prevent things.
And all this prevention that we're talking about, and that we've talked about for 10 years, is basically falls under the heading of epigenetics. Epi is just above or around, and what we do is with epigenetics is we do those things that keep those genes, our genotype, from making a bad phenotype. That's what prevention is all about, is epigenetics. Plain and simple.
Is there a difference between a genetic disease and a genetic predisposition?
Yeah, I mean,
yes.
a genetic disease is if you have those genes, for instance, like heart disease, you have that predisposition for heart disease. You don't do anything about it, or you do the wrong lifestyles, habits, etc., you can develop that. So that genotype will actually express as a phenotype that has a heart disease. So, the difference is, what do you do to keep from expressing that gene that way?
Well, no, but really, I think what he's asking on the question is there are genetic diseases that you're born with.
Well, those are.
Now, those genes, if you have a double mutation, they are going to come out instantly.
Yeah.
That is a different.
Right.
That you cannot change. If you were born with a genetic disease,
correct,
which means usually it is a specific gene that is completely wrong, yes, you can't. We're not talking about that today. Okay. We're talking about changing if you know it's in your family. You know everybody in your family. Everybody in my family's had this. What to do to actually make changes so that you don't follow that course.
Right.
But yeah, those genetic diseases definitely come out a lot of times at birth, the ones that...
Right.
Yeah.
Right, yeah.
Okay.
Or even...
Those are what we call birth defects.
Exactly.
Yeah.
More like, and that is gene problems.
Oh, it is.
Again, that's genetics as well. But we're talking today about things that you just know run in your family as people age, and what you can do early to change it.
Are there different types of cancers that fall under that?
Well, yeah, the
lot.
cancers definitely, you can have the genetic predisposition, just like we mentioned a minute ago, predisposition to have cancer. And people that say everybody in my family has cancer. Well, that means you need to do more specifically for prevention of cancer. And there is a lot of good natural supplements for prevention of cancer. A lot of your strong antioxidants, our cell support that we talked about a few weeks ago, that actually has a lot of the good things in it that are antioxidants, because it has your pomegranate extract, your broccoli extract, it has, you know,
Sulforaphane,
lycopenes, sulforaphane, it has milk thistle, turmeric, resveratrol. All those are cancer prevention, and also making sure you have a good clean diet. If you know everybody in your family has cancer, and we know that cancer is increased with exposure to toxins and carcinogens, you want to be extra careful not to get those. So you want to eat organic food, watch what hair products you use, skin products you use, get rid of all the chemicals. Get rid of the chemicals as much as you can. And you know, there's not 100% if you do all the right things, you're never going to get it, but it definitely decreases the risk.
Right.
Okay. How does someone find out if they have a genetic predisposition?
Mostly family history.
Well,
Yeah.
I mean, the way you start is look at your family history and go from there. If you know everybody in my family develops type 2 diabetes, okay, darn good chance that you will if you continue to, if you live the life that they've lived. And they've done a lot of different studies of identical twins. And these identical twins, they've got the same genetic code. I mean, their genotype is the same, identical, okay? But like, and later in life, you know, they get married, they go to college, they go to different colleges, they live on different parts of the world, they you know, their epigenetics changes. And one of them may develop some of those diseases and that are they're predisposed to, and the other one will not.
Right.
And they've done some really extensive studies on that over the past, say, 15, 18 years, 20 years. And it's shown to be very effective. You know, there's a couple of old ladies.
Yeah, we just saw it on actually LOX this weekend, that were 100 years old. And they both were turning 100. They were identical twins. But of course, they were always together. They said, we grew up and did everything together. Everything the same. And they both are living to 100. So they actually are both, you know, so that did show their epigenetics were very similar.
Yeah.
Because they lived in the same area, they were always together, they did everything together, so that does make a difference.
Yeah.
Yeah.
Wow, that's amazing. That's
It
amazing.
is.
It's something how just changing your lifestyle can really make
Make huge difference.
make
Yeah.
a huge difference
Yeah.
in you. All right, we're talking about genetic predisposition this morning, so we will take a break and we'll come back with more of the Doctor's Nutrition Show in just a moment. And welcome back to this morning's show. You know, we're talking about cancers and everything. I'd heard someone say one time that breast cancer, for instance, I knew someone that had got it and they were concerned about their daughter. She said, no, it usually skips a generation.
Not necessarily. We see a lot of women that the grandma, the mom, and the mom's daughter, the granddaughter all have it or all had it. Yeah. So it does not necessarily skip a generation. That might be, in some cases, it might skip one in different cancers, depending on what that person's done. Because that definitely does make a difference, what you do, your epigenetics.
No doubt about it.
Caller with a question, do you have anything for active bladder?
We do have something called bladder control.
I was going to say we have several.
Yeah.
That's one. If it's a male or female, that's the kind of thing. The difference between the two.
Right. It does make a difference.
It makes a difference.
In males, a lot of times it's actually the prostate, and it's not really the bladder. And then we use like Prostaflow. We use DN Prostate Max. So there's things that men can take. Now in women, if it's due to having bacteria, we use D-mannose. So D-mannose makes a difference. But then if it is just truly can't control the bladder, bladder's weak, got to go all the time, we do have something called bladder control.
Okay.
Yep.
How does someone find out, back to our original topic, how does someone find out if they have a genetic predisposition?
Well, you know, you can do the genetics, but it gets kind of pricey. And I had just recently had someone who did this, and oh my God, I mean, she was like, what have I done? She said, because she's overwhelmed with the information. I said, okay, we'll boil it down for you. You know, I'll get it down to where it's manageable for you. Because she only had a few things, you know, when you really go through all of it, there's only a few things that she needed to watch out for. The easiest way to do it, and what we suggest all the time, do your lab work. For instance, if you've got that cardiovascular disease in your family, if you've got that dementia in your family, a simple blood test for the homocysteine is a fantastic way to start out and find out if you got a problem. Because we know if we manage that homocysteine down to a nice low level, keep it very low, we're going to manage our ability to turn it into something bad.
Right. High homocysteine is predisposed to both brain problems like Alzheimer's or cardiovascular, but there's a lot of other things for cardiovascular.
Right.
Homocysteine alone is not going to tell you, because I see a lot of people, the homocysteine is normal. That ain't the problem. So when you start looking at cardiovascular disease, cholesterol ain't always the problem. I see people with totally perfect cholesterol, but yet their other markers are horrible, like homocysteine. And then there's something called lipoprotein A. That really is a genetic marker for cardiovascular disease. The higher your lipo A is, you know it's purely genetics. But you got to do everything you can to lower that. We have something called a super cardiac panel that does check all those cardiovascular risk. And at the same time, it's going to check all your sugar markers for the diabetes risk. It's going to check, there's a lot of things that can be checked on lab work. And if you see a problem on lab work, I always ask people when they come in and say, okay, what do I need to do? My first question is, what runs in your family? Exactly. And if they have problems that run in their family, even if they aren't having any problems, I suggest doing the lab work to see if they have the predisposition for it, so that they can start early before they start having any problems. That's what we really do push, is got to do it early. You don't want to wait until it's there. You don't wait until you have Alzheimer's. I'm definitely predisposed myself to Alzheimer's. My mom, my grandma's sister, they all had it. And so I do everything possible now for that. Even though on my lab work I don't show any of it there, but I know it's in the family.
That means the genotype is there, but the phenotype is what we're trying to keep from changing over to something that has that. That's what you're doing,
Caller with a question, do you have specific diets for chronic diseases?
Depends on the disease,
Right. It depends on, there's different, depending on, gout actually is a specific diet, kidney problems is a specific diet, diabetes is a specific diet. But no matter what problem you have, I don't care what disease you have, getting off of packaged processed foods is a good idea, because that is actually not good for any condition. So we do always recommend a real food diet, and depending on what kind of problem there is, it depends on what you have to be stricter on.
Right, exactly.
Well, we've talked about some of the different diseases and everything. What are there other diseases that are related to genetic predisposition? I mean, we talked about cancer, we talked about heart issues.
Your autoimmune diseases.
Yeah.
There's a lot of the, and we see a lot of people that have read a little bit about methylation. And matter of fact, we did a show, God knows, it's been a long time ago. We did a show on what is methylation way back when. And we see a lot of people come in and say, well, I've been reading about this methylation thing, and I'd kind of like to check into that. So, okay, you can do something like homocysteine, because if you can't methylate properly, that homocysteine is going to be high. So it tells you right there that you've got a methylation
We even
problem.
have a whole methylation panel that we can do that checks every nutrient that you have to have in order to methylate properly.
Right.
Now, methylation is one of the forms of detoxification.
Right.
And it is definitely, we're seeing, a lot of people have heard of the MTHFR mutation. And there's other, though, things that affect methylation as well, not just that gene.
There's over 100 genes.
There's a
in
lot
that
of genes
family.
that affect it. So methylation is huge, but if you don't methylate properly, a lot of times you do start seeing that homocysteine rise. And there's a lot of things you can do to keep that down. And that methylation is one that you definitely can do something about if you find it early, which that's one of the things in my family, and I've done stuff early so it don't show up on my lab work. But we definitely have the gene mutations that impair methylation.
Okay. Another question, what helps flush the prostate before bed?
Well, I would say probably one of the best things to do is to, make sure you drink plenty of water during the day, stay well hydrated so you're flushing the prostate all day long. That's the key. We see so many people that are dehydrated, but they're just dehydrated. And they say, well, no, I'm not dehydrated. Yeah, you are. If you're not going to the restroom within every couple hours, if you can go for 6 hours without going to the restroom, you're dehydrated, I'll promise you. So that's one of the biggies right there, is just making sure you keep enough fluids in your body so you can flush the thing out. And then, about 2 hours or so before you go to bed, stop drinking fluid or cut way back on it, so you don't have a full bladder or a bunch of fluids your body's got to process during the night which is going to make you get up.
And we do have two products that's really good to help with getting up in the middle of the night to go to the bathroom with prostate problems, and that is the Prostate Max and the Prostaflow. Those help shrink the prostate because honestly, a swollen prostate, which is very, very, very common in any men over 50, so it's not that it's an unusual problem, it's very common. It does help with that so that you don't get up as often during the night.
Okay. All right, we're talking about genetic predisposition here this morning, and we still have some more questions that we'll get to from our viewers out there. So stick around, of course, for that, and we'll let you know what we'll be talking about next week as well.
That's right.
All right, we're going to take a break. We'll be right back. And welcome back. Another question from a caller. Is anxiety hereditary?
I think the predisposition for it is. In other words, that's the thing. And that goes back, a lot of that anxiety and stuff goes to, now you've heard of methylation, I'm going to throw another one at you. It's called acetylation. Okay, so it's, I know, chemistry 101, but anyhow, that's what it goes into. So, and we don't hear much about that. The public doesn't seem to understand that acetylation quite as well as they've heard about the methylation problem.
Although methylation problems can also make anxiety, and that is genetic. So there's a lot of things that are different problems that are genetic that can cause anxiety. It's not all one thing. It might be different in different people.
Yes.
Yeah.
But what are some of the things that we can do epigenetically to help prevent genetic predisposition?
I'd say start out with the biggest thing that you can do is watch your diet. You know, making sure that it's a clean diet. You know, like we've said before, eat as much as you can that's organic. Stay away from your packaged processed foods because packaged processed foods are nothing but chemicals added to what used to be food. So we don't want that. It's not real food. You want real food, you know, and unfortunately that means we're going to have to prepare it and cook it and so on like that. But hey, there's some really good recipes out there for that. So be aware of that, and then be aware of your environment. You know, where you live, what are you around? You know, do you work in a toxic environment as far as chemicals and stuff? If so, you know, there's ways to protect yourself. You know, protective gloves, maybe a respirator if you're in a really toxic environment. There's all sorts of things you can do. And so that's just being aware of your genetics.
Right. And another thing is handling stress better.
Yes.
Because there's no doubt stress, and we all know we live in a stressful world. It seems like it's gotten worse over time. But the stress that everybody has actually makes that everything worse. Because cortisol starts elevating blood sugar. Blood sugar also starts causing other genetic issues. And also, it increases blood pressure. It increases, I mean, it does so many bad things that might be in you already. Maybe you're predisposed to it, but it's brought out by having the high cortisol, which is the stress hormone, which is another thing that we check a lot when we do the lab work. So again, I think the lab work is very important so you know what problems you have to work on, because if not, you're not really sure.
And then, you know, increasing exercise. You know, people, you know, and when we talk about exercise, you don't have to go join a gym. I mean, just get out and walk, something that simple. You know, that's a really big stress reliever. It increases blood flow, which helps the brain, helps the heart, helps the muscles. It helps all the way around. So there's a lot of things you can do epigenetically that really doesn't cost a lot. It's just simply making the right choices. Like she mentioned, the personal product that you might use on your hair, your skin, or whatever. You want to make sure that they don't have a lot of things in them that you
can't pronounce.
That you can't pronounce, right. And you can always go to and we've talked about it before, the environmental working group.
The parabens, the you know, some of the sulfates, the sodium lauryl sulfates, the parabens, those are too big, and phthalates. Those are some of the big ones that's in a lot of those products that you do not want. And a lot of the companies now that don't have it actually say they don't have it. If it don't say that they don't have it, it probably has it. That's kind of what you got, you know, I mean, honestly, if it says no SLS, which is sodium lauryl sulfate, no parabens, no phthalates, if it doesn't say that, it's usually going to have them. Because most companies specifically...
Well, they forgot, needly.
Most companies specifically do it without it, and they're going to tell you that, because that's kind of their selling point. So you do want to look for that.
Another question, what helps with eye health?
Overall health. I mean, just getting the right nutrients all the way around. I mean, there's
antioxidants,
so
and actually we have something called ocular support formula, which is specifically put together for eye health. And then you have your liposomal vitamin C. Liposomal vitamin C is actually probably good for just about anybody. It is a vitamin C that is way more absorbable than any other form because of the way that the body absorbs it. It's like 93% absorbable, to where the other best vitamin C out there is like 19% absorbable. But liposomal C has been shown to help a lot of times the pressure in the eyes. So liposomal C, especially if you have a problem with pressure, ocular support definitely has a wide variety of things. You can go to our website, doctorsnutrition.com, and look up ocular support, and it'll tell you what's in it. And there's a lot of good stuff in it.
Really good stuff.
There's I know with my situation, I have floaters in my right eye, but that pretty much they said it's because I got old.
Not necessarily, because there's a lot of old people that don't have it.
No, this is true. This is true. My dad had the best eyesight up into his 80s.
Yeah, really? Geez, that's good.
Yeah. So anyway, but genetic predisposition, we've been talking about that all morning, and how you can, even though your family may have histories of different things, there's ways that you can, the things that you can do so you won't have it.
Right.
Yeah,
that was the whole point of this show, is to really tell you that just because it's in your family does not mean you have to have it.
Right.
Honestly, in his family, there wasn't any of his direct male relatives that lived past 61.
Well, a little bit past, maybe.
Not
No,
much.
that's true.
No,
That's true,
61.
yeah.
None of your direct.
That's true.
None of them lived very long.
Yeah.
And he's 76, so he's lived way longer, but he's done a whole lot different than the rest of the people in his family.
Right.
Yep.
That's the main thing.
Yeah.
Yeah.
It is.
Yeah, okay. Anyway, be sure that you go to doctorsnutrition.com, also to the Facebook page, and go to YouTube now and subscribe to their YouTube channel and find a lot of great information. And you find a lot of the past shows on there as well that are informational. And then you get the newsletter on Sundays. I get my newsletter.
Sign up for the newsletter. You got to sign up for it.
People are always asking us about things. Just sign up for the newsletter, because they always want to know what's on sale. Sign up for that newsletter, and it'll tell you.
That's right.
Yep.
And they kind of give you an idea as to what to expect the following week,
right,
as far as what we'll be talking about.
Exactly.
Yep.
Now let's talk about our special for this week.
It's the liposomal vitamin C that Janine was just telling you about, the absorbability of it and so on. It's one that we rely on heavily, simply because we know if we give a patient a little bit of that, we're giving them a whole lot of vitamin C.
Right.
I mean, it's just so absorbable. And
it actually has with it your sunflower lecithin,
right,
which has a lot of phosphatidylcholine.
Right.
Phosphatidylcholine is good for the brain, it's good for the liver, it's good for the health. So you're also getting that along with it. And so that's really good. It's much better than a regular vitamin C and much more absorbable.
Yes.
So,
and the great thing too, whenever you go by Doctor's Nutrition, you don't have to have an appointment. You might have to wait a few minutes to see one of the doctors, but you never have to make an appointment, and there is no charge for consultation.
That's true.
Yep.
Tell me a doctor that does that.
Yep.
Yeah.
And like I said, if you come by, we'll kind of help you to see what lab work might be best for you, because it does make a difference to find out what you are predisposed to. And we find people every day, though, doing the lab work that say, well, nobody in my family has that. Well, you're the first. So you could be the first in your family. So you want to know what is coming up and what is going wrong.
And definitely want to try to make it so you can be the last.
Exactly. Not the,
And,
nobody else in your family do that. Anyway, don't forget, again, you can go to Facebook and click on the membership there, also on the YouTube. Find a lot of the great past programs to have on there. And next week, of course, being the first Monday of the month, will be Open Line.
Open Line.
Open Line Monday.
So be sure you get your questions together and tune in next Monday morning for another edition of the Doctor's Nutrition Show. Hope you have yourself a wonderful week.
For more information on highlighting your business and services on Healthy Living South Mississippi, contact Jim Tabor at 896-1313.